this is Ashley with Surrogate First and our bi-weekly webinars. I am super excited that we have Dr. Saeed Denishmand from San Diego Fertility Clinic. He's one of the world leading IVF doctors, reproductive endocrinologist. I mean, he's been a leader in innovations with IVF technologies. I definitely think that he is one of our favorite doctors that we work with. San Diego Fertility has been amazing partners in the last couple of years, helping our surrogates and intended parents bring their babies here earthside. So I'm super excited to have him. I'm Ashley, if you don't know. I'm a 4-time surrogate and the intake director at Surrogate First. I also am a surrogacy coach for intended parents with a leading medical support company. I also am, part of Seeds Ethics and Reproductive Alliance and Resolve and anything else I could get my hands on to get me out of the office. I'm there to help with the surrogacy community. But I would love to introduce you to Dr. D. Dr. D is internationally recognized fertility specialist with extensive experience in providing third-party reproductive services. He's collaborated, like I said previously, to develop in vitro fertilization IVF protocols to improve pregnancy rates. I mean, there isn't something that he doesn't do. He also speaks French, Spanish, Farsi. But Dr. D, would you mind sharing just a little bit about you and kind of what brought you here and where you're at?
Absolutely. No, it's really a pleasure. Thank you so much for those kind words, Ashley. It's a pleasure to be with you. For the past 25 years of my career, it's been really an honor and a privilege to help intended parents on their journeys to creating their families. Really, it's, as a father of 3 kids, of course, they're not kids now, they're grown up. This is a journey of love. And really, I want my intended parents, future parents, to experience the same joy of having children, creating their families. We've also done a lot of research over the past 25 years, have really contributed to the science of IVF. We looked at areas such as hyperstimulation syndrome, how to prevent that, receptivity of the uterus. When is the uterus receptive? What can we do to make the uterus more receptive? Genetic analysis of embryos prior to embryo transfer, developing techniques, non-invasive techniques, rather than just a biopsy, to be able to look at the culture media where the embryos grow and test the cells that are extruded from the embryo and test those for genetic abnormalities. So we've been very active. In fact, next week is the American Society of Reproductive Medicine Conference in New Orleans, and we have several papers that we're presenting there. It'll be our 27th consecutive year presenting original research at the American Society of Reproductive Medicine Conference. I guess I can go a little bit more in detail in terms of the SPAR, but Ashley, I'll let you sort of lead the way.
Yeah, no, and I love that you got to share a little bit about you. The other item I would love to be able to share is you are an amazing doctor, but you are also at an amazing facility. What makes San Diego Fertility Center one of the world leading IVF centers?
I can't do everything that I do without an amazing team around me. So from medical assistants to nurse coordinators to incredible embryologists and practice directors. I mean, the SCFC is comprised of a team, and we work as a team. All of us are always available to our intended parents. For example, my medical assistant, is always available to you via email, via phone. I typically give my cell phone to all my intended parents, to surrogates, so that I'm available to them if for some reason they're having, trouble reaching us via email. So it's about communication. It's about having a passion to take really good care of intended parents, take good care of donors and surrogates who really make all of this possible. And then I think, through research and just diligence and hard work over the course of many, many years and experience, our statistics really speak for themselves. If you go to the CDC website, you'll be able to see our pregnancy success rates. I think, it's really a point of pride for us to be able to place all the experience and research into developing techniques to maximize not only the success rates of IVF and embryo transfers, but also the health of the children that are born from IVF as well.
Definitely. I mean, I've noticed over time that as a surrogacy agency, Obviously, we want every family to have the best chance of success, and we want every surrogate who, passes our screening to be able to make it to surrogacy. But I really do respect and appreciate where, your team in the medical records field will be like, hey, Ashley, I don't think she's a good candidate,
Right.
And so that's it. We appreciate that because we're not medical doctors. We try to do our best to screen our surrogates, but to know
Right.
that you guys are looking out not only for the parent's chance of success, but of the health and safety of a woman who's willing to be a surrogate. And so
Absolutely.
I've never felt unsafe with every surrogate gets approved by San Diego Fertility. I know that they've been properly screened. I know that you guys are looking at their mind and their body and even their mental health to make sure that they'd be a good candidate for surrogacy. So I definitely love you guys. It's actually the reason I moved down to Pacific Beach was so that I could be closer to San Diego Fertility for our
Thank you.
clients. So, and
Thank
I do like the beach life, but
Thank you, Ashley. I mean, you've been amazing surrogate. You helped create families, and without amazing people like you, none of this journey is possible.
yeah, no, I love it. I think I'm addicted. I tell every surrogate, like, wait till you get to delivery and you watch the parents, then you'll call me, like it's amazing.
Yeah, that's true.
A couple things before we get started with the SPARS program, just to be able to share a little bit more information about our housekeeping and our surrogacy, Surrogate First. And so let me kind of head over there. I apologize for the delay. I'm still learning technology, but I am definitely getting better at it. A couple things about Surrogate First. We do have our no match, no fee guarantee. This is for our intended parents. There is no monies due until you've approved a surrogate's profile, she's approved your profile, the clinic's approved her medical records, and you guys do an in-depth match meeting. At that point, if you guys continue to move forward, that's when we would do that. We also do a pre-qualification of our surrogates. While that's not, in lieu of the medical screening with the IVF clinics, we do background checks on anyone over the age of 18 in the home. We do full psychological evaluations, drug panels, home evaluations, medical records are reviewed. So we definitely want to be able to be that 24/7 support, do our part, and then have our transparent fees. If you're a surrogate watching, a couple things to know. We do have a build your own compensation. Obviously, the sky is not the limit. We want to educate you on what is fair and what you feel comfortable with, but we do have that availability to move things around. We have a health and wellness program that starts when you sign with our agency all the way through the 4th trimester, to be able to help you with your mind, body, soul, help you to create an environment that is safe and nurturing and beneficial to you and baby during this pregnancy. We have our experienced surrogates. We have a Surrogate Plus program, and then we do have a supportive community, including if you are a current surrogate or a past surrogate, we will be having our surrogate retreat, which is a 4-day cruise out of Long Beach this year in January. So I'm super excited for that, and we look forward to helping you. This video will be available to anybody who's watching. It's going to be on YouTube. We also will send it out with a after the webinar survey. So definitely check that out. We're going to be covering today like the advancements in art with San Diego Fertility, SPARS program, kind of the 101. What is that? Surrogates and SPARS, because there are some extra things as surrogates we have to be able to do. Dr. D is definitely an expert on this. I've looked into it. I try to educate our surrogates as much as possible. But at the end of the day, know that if you do work with a parent who's been HIV positive and they've been through the SPARS program, you are going to have a director who will explain everything to you that's in the medical field to make sure that you are educated and you have educated consent. And then we'll have a little, sperm washing and then questions and answers session. So we'll definitely get started. The first thing I'd love to be able to find out more about is advancements in reproductive medicine. I know you kind of shared a little bit about that. You're sharing some papers at ASRM. And so love if you could touch on that a little bit.
Absolutely. Yeah. I think, some of the advancements that we have had in IVF have been sort of rooted in 2 areas. One is genetics. So an increased ability to be able to assess, detect genetic abnormalities in embryos prior to embryo transfer. So this sort of next generation sequencing of the DNA has allowed us to look more closely at each individual chromosome for chromosomal abnormalities like Down syndrome, but also other chromosomal abnormalities. Sometimes you can have smaller DNA mutations, partial segmental mutations, and we're able to identify those with the next generation sequencing that we do. So there's been really an advancement in the field of genetics. The other factor is that if we have the sperm provider and the egg provider, and if they both carry the same mutation, and there's no other choice in terms of other than moving forward with the IVF, then we can actually create probes for those particular mutations and determine if the embryo itself is affected by that particular mutation. We have many patients, for example, who have a history of certain diseases, even when they have one copy of that mutation, just a recessive copy. If that embryo has that recessive copy, there is a chance of having symptoms, future in life. So we can actually determine that with the embryo by creating probes. Those probes target those particular mutations, will tell us if that embryo carries that mutation. So it gives more information to intended parents in regards to be able to transfer embryos that are healthy and free of those genetic conditions that may cause significant health concerns. So that's one area. Really, genetics has blossomed significantly. The other area is just looking at how we create better quality eggs, and select out better quality sperm. So we have techniques now where we can select sperm based on DNA integrity. We have techniques such as microfluidics, zymote, where the sperm is actually placed through almost like this obstacle course. And based on research, it's been shown to decrease the level of fragmentation of the sperm that remain. So the sperm that remain have better DNA integrity, and we can then select those sperm and inject them inside the eggs. From an egg perspective, newer protocols, approaches, medications, dosages, protocols to be able to address specific and individualized specific factors with patients to help egg providers create better quality eggs, and also make the IVF process safer for patients going through IVF stimulation. So, looking at the technology and the advancements, and next week we're going to have many updates on the technological advances in IVF, better ability to create better quality eggs, selecting out the better quality sperm, genetic analysis of embryos, and then the last portion would be how can we maximize the receptivity of the uterus? What can we do at the time of the embryo transfer to maximize the chances of a healthy birth or a live birth and success? We have a paper that looks at different transfer techniques and which one is associated with the highest rate of success. And then also looking at the receptivity of the uterus. What medications? What if a particular surrogate comes in and their lining of uterus doesn't look good? What other protocols can we use with her? Do we use the modified natural protocol versus a medicated protocol? If it's medicated, what medications do we use? So all of those factors also to maximize receptivity. So we're looking at this and targeting all aspects of IVF, all aspects of the journey to really create a more successful and healthier journey for egg donors, for surrogates, and for ultimately the goal of intended parents who want healthy children.
I think it's just so fascinating. I know for myself, you were talking about like lining, thickening, and you have the wives' tales, right? So like surrogates are like, my lining is not getting thick enough. And we're like, palm juice and exercise and acupuncture,
Right.
like, but to know that like on the medical side, you guys are doing that, because I've seen nothing more heartbreaking than intended parent surrogate falling in love and that lining just not being thick enough for a good quality transfer. So that's exciting. I mean, especially too for parents and surrogates, like they put so much time to even get to the frozen embryo transfer, to know that there could be, possibilities of raising that chance of success is
absolutely. And you're so right, Ashley. It's we want to help surrogates achieve their goal of creating families for intended parents. And so, we will support them. We will do everything possible to get them there.
Awesome. I appreciate that. Now, here's a subject that not a lot of people talk about. When I research, I'm not finding a lot out there. Sadly, I was doing a intended parent consult through my coaching, company, and found out these parents were going to use one of the dad's DNA and sperm because the other was HIV positive. And I brought up, well, what about, SPAR? Have you looked into this program? And the tears that flowed through his eyes, like, I'm sorry, I get emotional. Like, he had no idea he could even have the opportunity to have a child with genetics and his DNA. And it was a game changer. Now they were like, wait a minute, now we could have an egg donor and we both could create embryos. And like, he was, I mean, just the relief in this and the fact that this has been around for 30 years, but nobody's talked, like, well, not nobody, but a lot of people in the public and the community don't even know this is an option. So maybe you
Right.
could kind of share, a little bit about, what SPARS is and how that works.
Yeah. So, all of this comes back. Obviously, now an HIV infection is not what it used to be. And, back when I was in medical school, we took care of many patients who had HIV, and it progressed to a significant immunodeficiency and the loss of life. And now an HIV infection is become a chronic condition, like many other chronic conditions, high blood pressure, diabetes. If you take your medications, you have a normal longevity of life and a healthy life. There's no evidence of any virus. Basically, what we talk about undetectable titers. So HIV has become like any other chronic condition, and we have many patients, intended parents, who are HIV positive, and with this avenue, with techniques such as SPAR, we're able to help them create the families in a very safe way. So just to sort of give you a little bit of a primer in terms of how SPAR came about, is many years ago. In fact, in the 1980s and 90s, there were some studies showing that men who were infected with the HIV virus, about 6% of them had evidence of free-floating virus in the semen. Now, of course, this is before the advent of these incredible medications, amazing medications that we have now that essentially eradicate the virus from the blood and make the virus undetectable. So because of that reason, techniques were developed, and there were techniques of sperm washing, but they became improved. And with sperm washing, what we found out was that if we can wash the sperm in a particular manner, then there's really no evidence of transmission of any virus or bacteria. In order to even go one step further, the Bedford Institute, which is a research institute in Boston, said, okay, what we can do is we can take the semen after ejaculation, and we can test it for the genetics of the virus. In other words, we can test it for the viral DNA and viral RNA. And by testing it, then what we can do is we can make sure that if RNA or DNA is not present, then there is no virus. So that's how the SPAR technique came about, is initially on sperm collection, the pre-washed sample is tested for HIV viral RNA. And if there's no RNA present, then that we know that sample is free of any particular virus. And then the sample is washed and concentrated and frozen. So by that particular technique, we absolutely ensure that there is no chance of transmission of the virus, to the surrogate. And I have to also say that even without the SPAR technique, the chance of there being a viral transmission in IVF, whether it's from an egg provider or a sperm provider, is essentially zero. Because with the techniques that we have, we're working with individual eggs, individual sperm, and the virus actually attaches to white blood cells, and sometimes it is in the free fluid, follicular fluid, or in the fluid of the semen. And because that's washed away, essentially, the risk becomes zero. Having the SPAR technique and also analyzing the ejaculate and the semen for evidence of viral RNA then ensures that absolutely the chance is zero. The other factor about SPAR that's important is it also educates the surrogate about the process, about the fact that this is safe, that the risk of transmission essentially is zero. There's testing that's done beforehand, blood tests with the surrogate, blood tests during pregnancy, and blood tests after pregnancy. So the SPAR program is a program to test the viral RNA, the viral genetics, to ensure that there is no chance of having any virus within the semen and the ejaculate, number one. And number two, it's an educational program, because it educates the intended parents, educates the surrogate, that yes, the risk essentially is zero. And really it provides protection and an ease of mind for both intended parents and surrogates as well. And we've been working with the SPAR program for many, many years now.
I appreciate it. So little known thing, I don't talk about it often, but at one point, one of my stepfathers back in the early 90s, obviously he contracted HIV.
Yeah.
It was a very painful, death, and we were young, but so to think about like potentially, luckily he, not luckily, but he contracted it after having his children,
Sure.
through drug use. And so to be able to know that there are people out there, even just people who were unaware and thought they were being safe, with their
Right.
partners. And
Right.
there's just so many things like this. It's come a long way. And I know that, a lot of women, a lot of surrogates partners have apprehension, right? There's
Absolutely.
I find surrogates are more open-minded, but partners, spouses, and girlfriends, and and boyfriends, like,
Yeah.
really are fearful of this. And I think there's a stigma that it's no longer that way. Many people are living full, healthy lives,
Yeah.
with HIV, and they are able to safely have their families. I think SPARS has been around for over 30 years, and
Yeah.
got like no children or carriers have ever contracted HIV. So
Yeah.
while you can never say 100% because this is science and
Right.
the FDA, the chances are extremely low. So I really appreciate sharing this because it's something close to my heart. I understand people, and so I definitely thank you for that. Now, for surrogates, what does this look like? Is there extra testing? Like, do they have to test for 20 years after surrogacy? Like, what is it?
No. Typically, just the testing is done, once previous. Obviously, we do the FDA's, the infectious disease screening, so that HIV test is included, and obviously in all the testing for surrogates. Then once during pregnancy, and then once 6 months after pregnancy. Again, it's very, very conservative. And there's never, as I said, there's never been a case of a transmission of any virus, any bacteria in the field of IVF, where we're using the latest techniques like ICSI and in order to create embryos. But this is almost like an extra precaution. So the surrogates have a meeting typically with one of the clinicians at the Bedford Institute to talk about, the SPAR program, educate them, and then about the testing as well. So it's just it's a few additional blood tests that the surrogate is going to consent to. But again, the health of the surrogate is of paramount importance, and we know with absolute certainty that with SPAR and with the sperm washing techniques that we have, there is a zero chance of transmission of the virus to the surrogate, to the embryo. It just is never happened before, and never will, with all the precautions that we have.
I appreciate that. I think that answered like all of the the questions in one. So I really do appreciate it. I know
My
you're
pleasure.
in between retrievals, so I definitely want to respect your time. FYI, guys, he is a working doctor, and he made time in between helping families grow. And so we definitely appreciate you.
My pleasure, Ashley.
Is there any other like frequently asked questions that you come across? For surrogates, I find that they're not going to meet with the SPAR program until after medical screening, when they know that they are medically screened. Is there any resources or any help if they were to see a profile of a parent who may be HIV positive and went through the program? Where could they learn more?
Absolutely. I mean, I recommend for surrogates to reach out to us. We have 5 physicians here. I'm one of the 5 fertility specialists here at San Diego Fertility Center. There are other clinics, depending on which clinic they're going to be working with. Reach out to the doctor you're going to be working with, and they'll be able, especially if they have experience in this arena, they'll be able to educate you, give you reassurance, and give you any information you need in order for you to feel comfortable and confident moving forward. Because again, the health of the surrogate is of paramount importance. That's always top of mind for us. But definitely reach out to the doctor, discuss your concerns and questions. And if it's a clinic that's really, again, has experience in this arena, they'll be able to answer all your questions and give you assurance as you move forward to help create a family.
Awesome. And if any families want to reach out, how do they contact San Diego Fertility, or how do they contact you? Obviously, you're an
Sure.
extremely busy man, but you have a whole team to help.
Absolutely. So the best person to reach is my medical assistant, Mai. That's MY, just like Mai, and it's mai@scfertility.com. That's her email. Please reach out to her, and she can schedule a consultation for you. And I'll be happy to sit down and discuss everything with you in detail.
Awesome. I appreciate that. And then if you are an intended parent, whether you are HIV positive or if you are just looking to build your family, please know that San Diego Fertility basically speaks, I'm going to be wrong, but like every language. I mean, anything that we've ever had, there is someone on the team. They have different departments to be able to help you. Dr. D himself speaks several languages. So know that if no matter where you are in the world, you have the ability to go there. They have an egg donor program too. So if you're looking for an egg donor, they can do everything from start to finish all the way through surrogacy. So definitely check them out, learn more about why they are one of the leaders in the IVF, world. Dr. D, we thank you so much. And I wish you nothing but the best on all of these retrievals, and that we bring lots of babies into this world.
Thank you, Ashley. And thank you for helping create families as you have done. It was an honor to have joined you today. And yes, wish you a lovely rest of the day. Thank you.
Bye.
Bye-bye.